Hello everyone. Good evening, Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health. We have a clinic in Henderson, we have a clinic in Reno, and tonight we're doing a Facebook Live talking about depression. Now, I didn't give anybody the time on when we do this, so I don't know how many people are going to chime in, but we had some questions come on beforehand that I'll try to address in this discussion. We also talked about depression last week in a Facebook Live, and hopefully I can kind of recap that and bring it all together so that there's better understanding of what's going on. For those of you who are wondering why you're not feeling so well, why maybe you are not having the energy that you once had, maybe you can't sleep, maybe you're just not enjoying your hobbies and activities as much as you used to. So to understand depression, we have to understand the brain. And there's something called the neural substrate. Neural substrate. The first time I heard that term was in reference to eye movement. So they call it the neural substrate of eye movement. So it's how your brain encodes how your eyes move. Well, there's also a neural substrate of depression. And that's a big thing we're going to talk about tonight. And hello, everybody who's joined. Good evening, good evening, good evening, and good afternoon. And we're going to talk more about the anterior cingulate tonight. We're going to talk about neurotransmitters because we've kind of been obliquely hinting at this in other broadcasts. But as we keep going, I'm going to keep going deeper. And I hope it makes sense. If you have any questions, chime in. If you have questions after I do this live video, send them to us, and I'll try to answer them directly to you that way. Okay. So here's the brain. I know I'm a phenomenal artist, and let's see, let's make this right there a little bit better. Okay, actually, I'm going to erase that because I need to draw through here. If we were to do a cross-section of your brain, so it's as though we cut your brain down the center, we'd be looking at your brain kind of in half. And this blue line I'm drawing is called the corpus callosum. And I'm trying to make it kind of fat because it is fat. It's a pretty dense, it's actually a very dense neurological structure that consists of white matter tracts. What are white matter tracts? White matter tracts are, in essence, like wires. That's what they basically are. They're wires that connect brain cells to other brain cells. So this mass of fibers, think of fiber optic cables going through the ocean. So this mass of wires going through your brain connect each hemisphere, right and left, left and right. Now, there's an area of the brain around this corpus callosum called the cingulate gyrus. And I'm going to draw it like this. As I mentioned last week, so hopefully you guys can see the green. I guess you can see it. And just so you know, we're working on our video production skills because lots of times I just want to get the information out there, but we will be working now and into the future in terms of making whiteboard images that you can all see. So the cingulate gyrus is particularly important because it deals with our frame of reference for our life. And some of you have heard me talk about this before, but this can assuredly be an important part of depression. The reason why I pause is because depression is so multifactorial. I was thinking about that before we came on. There's so many potentialities in terms of causation of someone's depression. But in my experience, it's important to look at this element of frame of reference because lots of times we put too many expectations on ourselves. There's the old saying, happiness is reality without expectations. And if we really digest what that means, and I'm not trying to say I'm a psychologist or anything like that, but what I will say is that being a board certified chiropractic neurologist, we look at the function of the brain from a neuroscience standpoint. And when there's a disconnect between two neurological phenomena, like you expect your life to be like this, but your life is adding up to be like that, that can be actually neurologically taxing. just like somebody who has a lesion in their parietal lobe, if somebody touches here, but they actually feel their hand, well, that's a problem too. There's a disconnect. There's a sensory disconnect. There's a frame of reference disconnect for what's referred to as their somatotopic mat. So that's where looking at one's thought patterns about where they think they should be can be important when we're looking at you holistically in terms of how you feel. And keep in mind that feelings are different than emotions. Those two terms are used interchangeably in our culture. Emotions are technically subcortical phenomena. So you may see a lion coming at you and you can have an emotion of fear before your brain even really realizes what's going on. So technically emotions are quick processes, they're reactions. Your feelings are the higher cortical processing, like in your anterior cingulate, of your emotions. So, and again, in the Facebook Lives, we go a little bit deeper than just what we talk about in some of our other broadcasts. So if it's too in-depth, let me know. Now, as I've talked about so much throughout the years, when it comes to the physiology of depression, we have the amygdala, which I'll write as AMY. So you have your amygdala. I'll put AMYG, amygdala. And your amygdala is a next door neighbor of your hippocampus, HIPPO. These are next door neighbors, and what the researchers find is that in depression, the amygdala tends to get overactivated. The amygdala fires through hardwired and chemical connections to your adrenal glands. The adrenal glands will make cortisol, and the cortisol feeds back and it actually kills brain cells in your hippocampus. Your hippocampus is one of two areas in your brain. One is the olfactory bulb, the other is the hippocampus, that makes new brain cells all the time. So cortisol and stress are incredibly important to the physiology of depression. What they find, technically, the amygdala actually talks to the hypothalamus. The hypothalamus, I'll put a little H here, the hypothalamus talks to your pituitary. Your pituitary makes something called ACTH, adrenocorticotropin hormone. That fires to the adrenals for the production of cortisol. So that's actually how it works. There is also a hardwired neurological connection between the brain and the adrenal glands for the production of adrenaline. Now, as I mentioned, the hippocampus is one of two areas that makes new brain cells. These brain cells in here are highly dependent on chemicals like serotonin and dopamine. So that becomes important because what we're looking at now at Gatesway Health for our patients who suffer with depression is, okay, well, how are you producing serotonin? How are you producing dopamine? How are you producing norepinephrine? And kind of, I don't know, it became popular around 2011, 2012. MTHFR, a lot of you have heard of MTHFR, stands for methyl tetrahydrofolate reductase, big word. All it means is that it's an enzyme in the body that converts inactive folic acid to active folic acid. And when you have active folic acid, then you can make neurotransmitters better. And kind of the epiphany back in those days was, well, you know, and there was research on this before then, but I'm just saying it was widely kind of accepted around that time. In essence, that if you can't make active folic acid, you can't make serotonin, you can't make dopamine, you can't make norepinephrine. So therefore, you may have a lack of those neurotransmitters to grow new brain cells in your hippocampus. We're now finding that this concept is far more complicated, and there are numerous genes interacting for neurogenesis, nerve cell growth in your hippocampus. But basically, be aware that the physiology of depression is such that the amygdala overactivates the production of cortisol that then feeds back, kills brain cells in the hippocampus, and then the amygdala literally, oh, wrong color, sorry guys. The amygdala literally starts growing into the real estate of the hippocampus. Now, let's see here. So we have cortisol. I'm going to put genetics, which can be things like MTHFR. You guys have heard me talk about COMT. So if you can't break down adrenaline, that can predispose somebody for greater anxiety responses from the amygdala. COMT. Okay, 3. Thyroid is hugely important. A lot of you have heard me talk about the thyroid throughout the years. If you have low thyroid hormones, that certainly can affect basically the cellular function of your brain cells, and that can be associated with depression. Hashimoto's I'm going to put as a distinct entity because Hashimoto's thyroiditis, where the immune system attacks the thyroid, the immune attack on the thyroid leads to immune cells that can go into the frontal lobes and actually reduce blood flow in that part of the brain. So that's really important too. I'm going to put hormones distinct from cortisol. So if you're going through menopause and you're not feeling as good anymore, well, your hormones can be affecting that. If you're, a middle-aged guy, you're stressed out, maybe you've gained 30 pounds, that can affect your hormonal structure to where your testosterone will drop, and that can affect your frontal lobe. So I'll put obesity, because with obesity, the more adipose tissue we have, the fat cells release inflammatory chemicals that actually go into the brain and poison our brain cells. And I'm going to put gut bacteria. Believe it or not, it's called metabolomics. Your gut bacteria produce a ton of different byproducts, and those byproducts can either help or hinder neurological function. Now, last week, I talked about this anterior cingulate area. And hopefully, let me draw it in red. It's called the subgenu. This is the genu of the corpus callosum, the subgenu portion of the anterior cingulate cortex. And let's just, for those of you joining in, that's the anterior cingulate cortex. The blue, again, is our corpus callosum. Okay. So hopefully you can see that. I think I'm doing pretty well, guys. I think this this artistry is coming together, if I say so myself. So this subgenu portion of the anterior cingulate cortex, or the subcallosal portion of the anterior cingulate cortex, as it's referred to in the literature we talked about last week, is selectively affected in patients who have depression. They're now calling this area, well, they're kind of referring to it as the SAD area of the brain. What they find that in healthy subjects, if they go in and basically have them think of sad events, this area of the brain becomes activated. Researchers have found that this area is less dense in patients with depression. Big finding. They've also found that if they take an electrode and stimulate this area of the brain while somebody's alive through deep brain stimulation, it actually can rectify their depression. So that's really, really interesting. So many of you may have the frame of reference of like somebody who has a heart arrhythmia. And what do? They put a pacemaker in. Well, pacemakers are becoming part of neurology and neurosurgery as well. You probably know somebody with Parkinson's disease. Deep brain stimulation is an option. Deep brain stimulation is now being heavily researched for all different types of movement disorders. And basically, it's being studied for depression too. A lot of you have heard of electroconvulsive therapy, which are the quote-unquote shock treatments. And shock treatments are thought to work on a similar premise, but it's a little different because you have to put somebody basically into a coma. They electrically stimulate them, and then they bring them out of the coma, and they see how they do. That's usually a last-ditch resort treatment for depression. But who knows in the future how well this will become accepted. So then the question becomes, well, why is this area less dense? And in our clinic at Gateway to Health, we're doing specialized MRI scans on some of our patients. It's also throughout the literature that you can assess the density of this area of the brain. And when I say specialized MRI scans, I'm just saying they're kind of unique MRI scans that are not commonly done to assess some of these things. So this area of the brain, a little less dense, and new research is tying the fact that decreased GABA in this area of the brain is associated with lack of enjoyment. So it's like the plot thickens. First, we know this is a sad area, less dense. Electrically stimulated and depressed people, they feel better. Now researchers are actually able to, through PET scans, go in and see how much GABA is in this area of the brain. There's some pretty sophisticated scientific technologies in today's day and age, and that's pretty remarkable. So it's called in vivo studying of GABA function. And what is GABA? GABA is the primary inhibitory neurotransmitter of the brain. So if you've heard of somebody taking Xanax, or somebody taking Ativan, or somebody taking Valium, or Klonopin, these are drugs that are designed to boost GABA function in the brain. They're commonly used in anxiety disorders because in anxiety we have an overactive amygdala that overexcites the brain. So if you take GABA agonists, in essence, then there's a probability of calming down the excessive neurological activity. But the researchers found decreased GABA stores in the anterior cingulate, the subcallosal portion of the anterior cingulate, of people who particularly have lack of enjoyment with their depression. There are different types of depression. Some patients who have depression are more just sad, but they still find enjoyment in their hobbies and activities. Other people are more, they just can't find pleasure in anything. And if you can't find pleasure in anything, it's referred to as anhedonia. And anhedonia in the research, particularly for adolescents, ties to very low GABA function in this area of the brain. So that's really cool, because then what do? We can actually look at, well, how can we help your brain improve GABA, particularly from a natural perspective, which is what we do at Gateswood Health. So recapping, you can see that there are many different facets to something like depression. Certainly, if you're depressed, you can go to your psychiatrist, you can go to your psychologist. Cognitive behavioral therapy with psychologists is an effective, well-accepted treatment for depression. Treatment with a psychiatrist, of course, is the standard treatment where they give you medications. What I find is that a lot of patients come to us who don't want to take the medications. They're resistant to taking the medications. And depression has such a stigma associated with it. It's hard enough to even swallow that somebody is depressed, let alone them be put on a medication. Now, I'm not anti-medication. You need a medication, take a medication. I'm just talking here about what I see. And the thing is that there's something called treatment-resistant depression. Treatment-resistant depression is a real entity, and it's super common. Some estimates I've seen it's around 40% of people will eventually fail antidepressant therapy. And if the antidepressants don't work, then what do? And that's the reason why the psychiatric literature has become voluminous in studying everything I'm talking about, because they're trying, this comes from the psychiatrists, they're trying to figure out why some people are so depressed. And as you can see, hormonal components, genetic components, more hormones, autoimmune components, basically dietary components and gut bacteria relative to obesity and gut bacteria. These are some of the major factors. Then you tie in maybe a lack of GABA function here. Then you maybe tie in your life isn't where you expect you should be. Maybe just in one realm. Maybe your relationship is amazing, but your career is not. Or your career is amazing, your family's amazing, but your relationships are not. Or maybe, you know, you have a boss at work who's just an absolute maniac. So these things can heavily affect this anterior cingulate cortex. So it's pretty cool. It's actually pretty dang cool in terms of what we're learning about the brain as it pertains to depression. So I hope you guys found this helpful, and hello to everybody who joined, and hello to all of you, and thank you so much for tuning in. I have one question. What's the real treatment? The real treatment depends on what's going on. The real treatment can be taking antidepressants from a psychiatrist. It can be seeing the psychotherapist. It can also be addressing all of these factors I've outlined in a stepwise organized approach to handle each one individually, or you can do an individualized history to figure out which one of these factors particularly pertains to someone's depression. And you know, we have a comment talking about how meds can make things worse, and that really ties in with the treatment-resistant depression. So some folks will take an antidepressant and they feel worse. Some folks take a natural supplement and they feel worse. This is actually pretty involved, and it takes some considerable experience, in my experience, to be able to work with this from a natural perspective, because it can be tricky, and unless you're going to run $10,000 worth of testing, lots of times it's hard. It takes a little trial and error to figure out. I think I covered all the questions. So I thank you all for joining in. I really do. It's great to see you guys. And one last question. Apart from the exercise we do on a long-term basis to help, is there something to do in the moment when it really hits? So a lot of you know that I'm dealing with stress relaxation techniques now. If you don't know about this, give me a call. We can talk about it. But what I'm trying to do is find ways to decompress this anterior cingulate area. Your legs are pretty closely connected to the anterior cingulate area. Your legs are right through here in terms of their what's referred to as their somatotopic organization. Lots of times, though, in terms of what you can do, if I've given you a stress relaxation exercise, lots of times I would advocate doing that when something stressful hits. Why? Because we don't want a campfire to become, and maybe that's a bad example, we don't want a small fire to become a big fire. I say that in light of the recent events in Paradise, California. So you don't want a small little smoldering batch of coals to become a forest fire. And that's what happens with stress for a lot of you, because you already have the tendency to have an overactivated amygdala, right? Already a tendency to make way too much cortisol that feeds back and kills your hippocampus. That's going on even when you're not stressed. Maybe I didn't make that point. So then when you are under stress and stress hits you, then what happens? Now the system goes way up, and it's already up. So that's where it's so important to shut down those stressful thoughts. It's a battle for all of us, trust me. It's a battle for all of us. And I think the more we become aware, the better we are able to do these stress relaxation exercises to facilitate shutting off these stress pathways in our brain. So hopefully that helps with that question. Hi guys, no worries. So if you missed this, go back and watch it. I think this is one of my best pieces of artwork ever. Tongue in cheek. And thank you all, and let me know your feedback, let me know your comments, and we will talk to you next week. So have a good night, everyone, and we'll talk to you soon.